Yeah, record.
Oh, yes! I'm so glad you're here. And you don't even know what to do. That's awesome. Okay. All right, here we are. We've got, can we see us though? We're kind of like not really able to see. We need to have to, there we go. We'll have to just hold our drums up. Okay, you want to have this? What drum are you going to have?
I will shake the rattle.
You're going to shake. Okay, let's try to just keep ourselves in the screen if we can. Okay, so we're just going to sing a song that we almost all, well, we like this song. I like it. Tis a gift to be simple, tis a gift to be free, tis a gift to come down where we ought to be. When we find ourselves in the place just right, we'll be in the valley of love and delight. When true simplicity is bent, to bow and to bend, we shan't be ashamed to turn, to be our delight, till by turning we come round right. All right, and we'll have Nikki pray. We'll hold hands. We like to hold hands. Okay.
Father in heaven, we are grateful to be able to be here as sisters to learn this important thing that we might be able to serve thy children. We are grateful for the technology that can bind us together through the miles, and pray that it will continue to work properly for us. We are grateful to be learning these things and know that it will be of great importance in the future, and pray that we might learn much today and be able to feel thy spirit guiding us. We're so thankful for thy help in all the areas that we need in our lives, and we continue to pray for light and goodness to go throughout the world and to help us all. We love thee and thank thee and ask for these blessings in the name of thy Son, Jesus Christ. Amen.
Amen. Well, I just want to start out with talking about what happened this morning and how it compares to birth. We had so many little glitches on the track of this class, but one of them was that the power went out this morning. So up until recently, we didn't have power, which meant a lot of things wouldn't work properly. And then we couldn't get the internet on my computer to work. Thankfully, Faye had her iPad, which we're using. And, but right in a couple of moments, I was getting stressed, and Faye was like putting her hand on my, what were you doing? Okay, we have to be able to have them see us, because I think this is really significant. You know, when you're not feeling, like when you're in labor, you're going to encounter, or when you're helping someone in labor, you're going to encounter women who are getting maybe on the verge of even panicking. You know, like I think I was getting agitated, and it had built, right? The smoke alarm was chirping. My husband, I was like, Kevin, get this on. You know, but anyway, so show me what you did. Okay, let's just, can you make sure that you can see properly now? Okay, so you're going to demonstrate. So I'm just kind of just look at me like this, and you show me what you did.
Charlene was getting agitated, and inside I'm praying for her, and I'm touching her with my cool, calm hands, and I
really
just
slowly,
knees,
very slow, like it's a pacing breathing thing, right? And then she's modeling for me. She's looking in my eyes, and she's modeling calm, and she's just like putting her hands on my legs, and right away my whole body went into, I was able to take a breath. I was able to go, okay, she's calm. So I can, it's a contagious thing, right? Like I can actually draw in her calm. So thank you for that. And I want you to look your eyes right in there really close and just say it to them as you would say it.
Where's the camera?
Yeah, and just say it to them as you would say it to a mother if she was going through something like that.
A lot of times when moms are getting amped, you don't actually say words to them, but sometimes you do. You need to just bring them and center them in. And a lot of times you can do that just with a touch and with breathing and maybe a look at me, everything's okay. And you don't have to amplify your voice to try to speak over what's going on or the noise that they're making. A lot of times we just bring it down and talk more softly so that you do possess the room with your softness and your calm.
Yes. And one thing that has been really coming up for me in my own experience with my own, complex PTSD that I've been healing from, which is kind of what can happen in birth, where it can trigger people's other traumas, right? And that is the pacing being really significant. And that is slowing the energy down. So how you have to slow energy down is, first of all, you have to recognize where it's at. Sometimes you can go in, like she said, and you can go in and you can just go in softly right underneath it and bring it down. Sometimes you have to meet it where it is and just bring it down from where it was, because there's too big of a gap. So you take it, you might go as fast as her, but then you're going to slow it down and she's going to mirror you. She's going to be able to mirror you. So do you want to do an example? Can you pretend you're agitated?
Me?
Yeah, and you're in labor, okay, and you're agitated. And then Nikki's going to come along and help you. Okay, let's give a scenario. Your husband's not in the house. You are having your baby. There's the hospital's too full. So your plans have changed suddenly. You were supposed to have a hospital birth. Now your husband's not home and you're having a precipitous birth. This is your neighbor, but she has experience and training, so she's going to help you. Okay. So you're upset about that right now.
I feel having my baby. Nobody's here. Help me. I don't know what to do.
I've done this before. I've got you. Okay.
Okay.
We're gonna do this together.
I don't know if I can do this. I just don't know if I can do it.
Okay.
Okay. Are you sure? I just don't know if I can do this.
Breathe with me, Nikki.
Okay. I don't know. Can I do this?
You've got this. We've got this together.
Okay. Okay. I don't know. Are you sure? I just don't know if I can do this. Okay. I think I maybe can.
I'm gonna help you.
Okay. Thank you.
Okay. So see how she's got her from, she didn't, like, she kept kind of expressing herself, which maybe she needed to do, but she just kept mirroring the calm. And see how nice that turned out. Okay, so we're going to go through a few basic principles that we teach in our classes. Before we do, does anybody have any pertinent comments or questions that you want to make? We want to just get right into it here. Okay, so I thought we would do.
Oh, Charlene, I have a question.
Yeah.
This is probably going to sound very naive, but is there ever an appropriate time to raise your voice?
Yes. It would be if, like, there's a bunch of people and they're being disruptive in the birth, like that could be at any given time during the birth. You would try to use your words without too much vocalization. But if people are making noise and you have to gather that crowd and get them out of there, yes, you take a command voice. You're a general in an army at that moment. And yes, it doesn't matter. She's in her own little bubble. If you're not talking to her and you're taking care of her and she can kind of sense that is happening, it's going to be okay. you know, so some of the circumstances for that and the reasoning for that I want to get into, which is the hormonal cocktail. Now, the hormonal cocktail is probably one of the most important things that you can understand, I guess, about how to create the right atmosphere in birth. Okay, I feel like this isn't the best angle here, but sorry guys, this is, there it is. Let's try that. Okay, so, so you've got the labor, which is starting when she's in active labor. So active labor is the contractions are coming, lasting for a full minute, and they are 4 minutes apart for 1 to 2 full hours. That's active labor. Before active labor, she should be kind of just, you know, going through her normal life, right? Getting ready, but not overexerting herself, eating, resting, doing all those things. Light exercise. But then when she's in active labor, that's when, if it's your job to help her, that's when she needs help, okay? And in order for her to have the proper physiological responses that her body needs to have, like for her contractions to be rhythmic, for them to do what they need to do, which is dilating the cervix to 10 centimeters. You don't need to know if it's 10 centimeters. There's no research to support that knowing that helps anything. It's best just to trust and let her body do what it needs to do without actively having her push, just letting her push when she can't help but push, never suggesting or trying to coach pushing, just letting the body do it on its own. But the important thing about that hormonal cocktail is to keep it high. It is literally, we don't even know how many hormones are involved in that, literally a cascade of, a cocktail of amazing, amazing biochemical engineering by the deity, the divine design of God. I feel my whole body's just vibrating right now as I'm saying that. So what we want to do is keep that high. And women are highly suggestible. They're very, very sensitive. If you think of like a kitty or a little puppy trying to birth, and if there's noise around that puppy, or if somebody's coming around and rubbing that puppy's, you know, babies, or I don't know, just getting involved when they shouldn't, or making noise, that's going to disrupt the natural physiological process of that birth, right? Mm-hmm. It is a full-on perfect design when it's uninterrupted. And what is an interruption? An interruption is anything that disturbs the flow of the hormones from the beginning of labor. It's going to build like this. By the time she's in active labor, it's going to be up here. We want to keep it up here. We don't want any interruptions to that hormonal cocktail. She's going to have her baby, and then we want to keep it up here after too, because that's going to prevent bleeding. It's going to encourage proper bonding, proper imprinting of the baby and the mother, will reduce postpartum depression. Everything is better if that cocktail is kept high. So Faye, I want you to come forward and teach us just a couple things that you think help keep the cocktail high in labor and postpartum.
Can I ask one quick question before you go to that
Deb.
part?
Hi, Deb.
Hi, it's been a long time since I've had a child. And they were mostly C-sections. So what position, when you're at that point where the hormonal cocktail is starting to elevate, what position should you have the woman in at that time? Should she be sitting, squatting?
Okay, that's a good question.
Laying down?
I will have Faline to address that question. So perfect, thank you.
Okay, it kind of goes along with
Hi, Ann.
Keeping the interruptions out. In the situations that we're talking about, you won't be directing the mom at all. You'll be encouraging her to direct herself, what feels best. And you'll observe her a lot to see that she's comfortable with the people who are there. Hopefully it is just her husband and yourself, and anyone else would probably be out of the room. especially moms or mother-in-laws, they can be hard. It can be hard for them to be in there and to see the mom going through the pain if it's their own daughter and things like that. I wouldn't say that you would force any of them out unless you were observing that the mother was uncomfortable with them there. Interruptions could be their children. Interruptions would definitely be anyone who's really trying to control the situation beyond what the mom would want. Some mothers may need a lot of direction because they want to put themselves into your hands. So it would be, for those moms, you do need to take more charge and be letting them know that you've got this and helping them to know what to do. But for the most part, you really want to observe moms and encourage them to listen to themselves and find out what position is going to be best. Because this isn't about you and what you can see. This is about what's going to get that baby out best. And especially there at the end, they may be moving around a lot, or they may settle into a position. If they've settled into a position and you see that they don't seem to be progressing, then you may want to encourage them to change positions. We will be going into some positions later on, I'm sure.
We'll demonstrate.
Yeah. Yeah. So just preserving that bubble for her. And some of the ways you can do that is if you're in a position where you don't have a private room, you can actually have people hold up blankets or stand as barriers spacing out to make the privacy.
And can I just add one thing? That is that if you have only one person, sometimes you might need another person to help you. So you might be soliciting help. You might send that person, say if there's someone there that you kind of think would be better out of the room, and you need towels, you need water, you need a receptacle for her to vomit in or pee in or void in. You know, those are important things to have at a birth, like a receptacle, some kind of clean underpads, and you might also ask someone to go call 911 as well. If you have that capacity and you're not a fully trained person. I mean, if you're just like trained in unexpected childbirth and there's no other options, of course, you're going to just do what you can. But if you can call 911 and get help, then you will, of course, do that also.
Can I add one thing?
Sure.
Yes,
and can you go
please.
close up so they can see you? Yeah. There you go.
One thing too is that a lot of women do not understand, unless they have gone to a midwife or something, but they don't understand that their body knows exactly what to do. You know, that's just an innate thing. I didn't know that, at least when I was birthing my children. I just thought I had to do what the doctor, you know, said, and I didn't know that I had intuitive things that I should follow, you know. So I think just helping them understand that, you know what, your body knows exactly what to do, and you just need to be able to come into calm and trust your feelings and trust that intuition.
I'd like to interject there with just another role play. Could we reverse it where you're distressed and you're helping her? Okay, and maybe we'll try some alternative ways to help her than what she did for you, just if you can, or whatever feels natural for you. Just go with your flow, okay? Okay, so the scenario is you're in a store and your water just broke and your children are with the storekeeper right now, and you guys are in the back room and you've already called 911. Okay.
Okay. So, are you doing all right? Can I help you?
Is this how it's supposed to be?
Yeah, I know. It's okay. Guess what? Your body knows exactly what to do. It's okay. It's okay. Things are going to happen as they should. So just feel what you need to do and go. It's okay. It's okay. Just breathe with me. Just breathe with me. Okay. Would you like to lay down? Feel comfortable? Okay. That is fine. You do what feels right. Now what? That is okay. Okay. gonna get some help here. And you and you go get this and this and this. And then you come here and help me. Okay, let's surround her and face outward. And we're just gonna give her some space here. Okay. All right.
Very
One
good.
hit. Okay. Come here. Okay. So here we are. Here we are. So let's just go down. Let's go down on our knees. Okay. That feels right. Okay. All right. Let's just breathe, breathe. Okay. You can do this. You can do this. Your body knows exactly what you need to do. Just feel that intuition, okay?
Great. Oh, lovely, lovely.
Thank you.
You know, I think letting them know that their body knows what to do is a really good idea. Because I remember with my first birth, which I had naturally, it
Deb, I'm
was,
going to stop you, sweetheart, because
yeah.
I can't have you telling that story right now. I'd love to
No,
hear
I
it.
wasn't going to tell the story. I was
Okay.
just going to say it was very traumatic for me because I didn't know what was going on.
Well,
And
I pray
so-
right now that this class will help release some of that trauma for you, because that's
Yeah.
what it does. I can feel it
Yeah.
right now. And it'll help you to have, because it's traumatic. Birth is a potential for high transcendence, just like life, but also
Yeah.
trauma can be in there, right?
Yeah.
Okay,
Yeah.
so what
Can I
I
say
like,
something, please? Can I just say
Yes.
something quickly? I really
Absolutely.
loved when she said it's not how it was supposed to be, and you just kept going with it. You didn't get into, well, we'll talk. It's how it is. Just keep her focused
It
on
is what
she's
it is.
supposed to be doing.
yeah.
Right? I
One of
really
my
appreciated
favorite
that.
mugs is it is what it is. And at birth, I think whatever we focus on is going to grow. It's just like in life. Whatever we put our energy and our attention on, it's a principle. It will expand. So we want to help her keep her focus on her baby's coming. She can do it. She's got the help she needs. It's okay to be a little bit discombobulated at times. This will pass. This is temporary right now, and we're moving on. And so you keep her moving with her birth, and I think moving around, keeping her drinking fluids, keeping her urinating. Those are some really important things. So movement, and then the flow of fluids going in and out of the body. It really helps the body to process a lot of the biochemicals of birth in the liver and in the kidneys, and it helps the mother to just reduces pain. When you're hydrated, you don't have as much pain. So you want to keep a woman hydrated. I think having electrolytes is really good. I'd really like to go through a full birth scenario, even though I really want to teach you more about the hormonal cocktail. But let me just give you two. You didn't finish, did you?
You mean, did I have a baby or did I finish?
Did you finish what you wanted to say?
Yeah.
Okay, good. So what I wanted to say though is this, that when we disrupt or interrupt either the labor, the delivery, or the postpartum, they're all the same. You'll notice that deliveries in the hospital or in movies and stuff, as soon as the baby's born, everybody's partying, right? That is a no-no. That is an interruption, okay? Anything to do with loud noises or phoning people or just bringing new people in the room that she's not used to, you wouldn't do it with a kitty. You wouldn't do it with a puppy. Don't do it with a mummy. And so, yes, we be tender. And the kinds of things that create that hormonal cocktail are the same kinds of the actual things that create a safe feeling, a feeling of peace, a feeling of calm, a feeling of being nurtured and safe. So dim lights, calm words, slow pacing, running water can be nice if you have it. And a contagious sense of peace. So you know, that comes from your heart space. You can't fake it. You can't fake it and put it on your face that you're smiling and acting like you're okay. But in your heart and in your body, you're tense and fearful. It doesn't go. Those two frequencies don't match. And your frequency is going to be matched by her and by everyone else in the room. So what you want to do is you create that energy of peace and calm and trust. You can't change the outcome. You know, you can do your very best. That's all you can do. And you have to get detached from fear and from the outcome. You have to go, I have angelic ministers around me. I have my own higher self here to help me too, and the Holy Ghost, whatever you believe in. I think it's good to believe in deity personally, because at a birth, they're always there. The angels are there like whispering in my ear, you know. It's great. I mean, and they help you move your hands. You don't know what to do. Oh, well, I don't know. I don't even know what I did, but I just did it and it worked. And it was an angel. And I mean, you know, you want to go in there with as much reason and intellect and intuition combined together. But then the other element is the deity, where you have that faith. So you let go. You don't have an attachment to the agenda, to the timing, to the outcome. Even if there was anything that happened, okay, now I want to go into some complications, but before that, I just want to do one really, really normal birth. But let me just say that in the postpartum period, what do you think are some of the things that are going to be helped the most from keeping the hormonal cocktail up? What will be the most significant result of that? Does anybody have any thoughts? Well, it is that the mother her uterus will do what it's supposed to do, because those cocktails cause the uterus to clamp down. They minimize bleeding. They maximize good child-mother bonding, which is essential for the baby to imprint, to build their intact capacity to love. That baby is hypersensitive also. So keeping that bond, skin to skin, mom and baby, and making sure the baby's dry after the birth too is really important, because the babies can lose their heat. So let's go through a scenario. If you guys want to grab a baby and
Okay, baby right there.
I don't know if you want to use, we just made new placentas. This one has a very long cord. And so we use that one. And we'll have you be the mama again. Do you want it? And you be the midwife.
Okay, remember I'm still learning.
And Nikki's still learning, so
feel free to correct me.
And suggest things.
Yes.
oh, I will. Okay. All right. So what's the scenario? How about you tell us what scenarios?
I'm pregnant. This is going to be a very normal, no variation type of delivery.
Okay. Trying to get this so it goes by itself without me. Oopsie.
I'm in my home. Been laboring for a while. Nikki's here. My husband's here. He's supporting my back. We'll pretend like he's here. Shut that placenta back up.
Okay.
I think that was a push.
It's fine. You just go with what feels like you need to.
Is it okay for me to push now? The doctor always told me when to push.
You know what? You need to feel your body. Do what your body wants to do. You got this. Hopefully you haven't been. The baby off.
There's blankets right
Blanket.
behind her.
Oh. Good. So good. Okay.
So her legs are kind of
Okay,
shaky.
let's get a blanket for
Here's
you.
another blanket right here.
Right. Okay. All right.
So you want to check her bleeding.
Okay. Check for bleeding.
And
Okay.
that's it.
No bleeding.
And if there's a gush, then we know that's a placenta, right? Okay, I just want to sort of pause this action for a second here, just because I want to talk about this, okay? So they're at this point now where the baby's on her chest. She's in an upright position and the placenta is still inside, okay? Now she may stay there for a few minutes. It may be difficult to really assess the bleeding of the mother in this position. And so I'm going to suggest that you help the mother get into a lying down position in order to really assess anything. That's really better. And it's also best for laid back breastfeeding. In a low resource setting, you must do laid back breastfeeding, not sitting up breastfeeding. That's the old fashioned way to breastfeed, which was more for bottle feeding. And it has very poor latch outcomes. So in order to have 100% breastfeeding rates, we must fully adopt a laid back breastfeeding style, which we'll demonstrate right now.
So blankets off just for the demonstration.
Okay.
And why don't we go ahead and deliver the placenta?
Okay.
So just help me up. Push. And out it comes.
Okay.
Lay down with my baby now.
Let me put this in the bag. Okay. Now,
You're just going to put that down beside the baby, wrap it in a little bag or whatever.
put it in the bag. And put it
In a bowl.
down. Good. Okay.
And then now you're going to check her fundus.
Okay. So, well, oh, your tummy, sorry.
Sorry, her tummy.
Okay.
So just
So-
above between the pubic bone and the belly button.
Here's my pubic bone.
So right in here.
Feel the uterus down in there.
Is there any way, would you be willing to expose your belly?
No problem.
Just think for
I'm happy to
landmarking.
have the belly.
How many babies have you had, Faye?
I have had 8.
She's had 8 babies
Okay.
and they're amazing.
So right here. Okay.
Feel it.
So
You will actually feel it because my uterus is a lot smaller right now.
yeah. Okay. So you can feel that there's
see. What happened there?
sometimes is kind of mushy feeling.
Yeah. Oops. So just hold it.
Okay.
Beat it in the face.
Okay, sorry.
Luckily, nobody got dizzy.
Okay. So now when she's nursing, that is going to help contract that, right?
Or just
Even
the
not
baby,
nursing,
or
even not
just
nursing.
patty.
Let's let her demonstrate the laid back breastfeeding here and see.
So as baby's gonna come up, baby's patting around, mouthing, and you're just gonna kind of let that baby, maybe you'll direct the nipple a little, but baby's just gonna get it.
And all the patting, and all
Lots of
the-
patting.
all the licking and sucking, we think we want that baby on there, like sucking on the nipple instantly. And, nurses will get in there and start pushing it in there and doing all this intervention. That's a disruption, okay? Remember we talked about disruptions? Well, any disruption to the breastfeeding, whether it's the mother or the baby, is a disruption to the hormonal cocktail, not only for the babe, for the mother, but for the imprinting I mentioned, that sensitive imprinting with the baby's intact capacity to love and trust, which means there's no birth trauma. So they don't have that ongoing PTSD, which causes multiple problems. And we're keeping the cord intact here. That's why we didn't cut it. We're keeping everything intact. So they've proven that
I'm sorry, we can't hear you. Did something happen with your?
It's the way I'm holding it. I think I'm covering the mic.
Oh, mics.
Okay. How about there? Is that better?
Yeah, I can hear you now.
Okay, sorry about that. So all the licking, sucking, and head bobbing are all doing the same or similar to what it would be if the baby was sucking. So just keep that in mind. It keeps the hormones out. And then another thing about this baby that we need to talk about just briefly is if the baby's cord was around the neck. So I'm just going to let them just go backwards and demonstrate that.
Okay.
I just want to make sure we get that. And I need to not touch that. If I touch the sound again, I'll try not to touch the side. On both sides. Okay. Top and bottom. Okay, top and bottom. Okay, we're going to go through. Can we start right at the beginning? And we're going to do a cord wrap. And then I'm also going to add another complication in because why not? Most births are normal, but you need to know how to deal with complications. So we're going to go with, let's see, we're going to go with sticky shoulders. And I'm just going to review sticky shoulders while they're
cord and
sticky shoulders. Okay. So I'm actually going to review this chart real quick before we go into this scenario. Can you guys just read real quick? We'll read a little bit of this just to give you a little bit of an idea before we jump in.
Okay. So sticky shoulders or shoulder dystocia. Allow birth of head to happen on its own. Wait for the body, which will normally come within 1 or 2 contractions after the head. Have the mother push with contractions. If there is a turtling sign or body is not born, you must change. Do you want to explain what turtling means?
Yes, the turtling is when the baby's head is coming out, but it's not coming right down to here where you can see the chin. It's kind of like, looks like it's like it got a turtleneck on.
Okay. So you must change the mother's position to encourage a change inside. So like if she's on her, back or standing or whatever she's doing, you're going to want to change her position so that you can have a different angle. Pelvis molds to baby's body with movement. So as she moves, it's going to mold to the baby's body. Help mother move to hands and knees. Supported standing squat. So either of those. Okay, so
And
either hands
you
or
can
knees.
rotate through them as you feel inclined.
I think that this time, even though a lot of times you can get the baby out with one position change, we're going to go through a number of position changes to show you that, you allow one push and then you change again. So that you can be sure to help that baby get out, because by the time you've realized that they are stuck, you're running out of time. You want to help them out.
And you only have the mother push with the contraction. Sometimes you have to use nipple stimulation. The father can help with that.
Okay.
If the contractions are really slow.
Which a lot of times at the end pushing they are.
Mm-hmm.
Okay, you can also try McRoberts, and that's where the mother is lying on her back, and you're helping her hold her knees up toward her shoulders and fully opening the pelvis. Suprapubic pressure to release anterior shoulder. Push firmly in the direction toward the baby's chest.
We'll demonstrate that with the doll. Why don't we just do that right now? Nikki or
Can I hold
Faye?
that?
Yes,
You
please.
want to?
Faye, I'm just gonna get the pelvis. And would you?
Yep.
Oh, it's right here. Okay, sure, right there.
All right, so there we go. Little pelvis is right where?
Right there.
Here. All right.
Okay.
So can you see me? You'll have to look at that so you know what you're filming, because you gotta be able to see it. Think real close up if you can.
I suppose you got your baby.
Okay, so let's just say, for example, this is the baby's inside, and
Here's the pelvis.
And the baby's coming down, and this looks like this cord's got a wrap. But also this mama ate a lot of sugar. She ate a lot of sugar. She ate a lot of fruit smoothies, and she thought she was doing real good, but she had a high glycemic diet. And the baby's shoulder width is wide. That will do it, I promise you. It's better to eat vegetables, protein, and low glycemic foods in pregnancy. Anyway, so reduces the risk of shoulder dystocia. So, but this baby's got wide shoulders. It's 9.5, 10 pounds. And the babies, it doesn't mean they have to ever get stuck though. They really don't have to.
Little babies can get stuck, big babies can
It doesn't
come out
really
just
matter.
fine.
Exactly. That's the absolute truth. So here we are. Now for suprapubic pressure, we want to push towards the baby's chest. You see, here's the baby's chest. So I know the baby's this way because I can see the head down here. So I'm going to take my hands, I'm going to take both of them, and I'm going to push this way like this on top, like that. Of course, this is on top of the mom, so you can't see it, but you can feel the pubic bone. And so then you can go ahead. And just to give you a little example of something that's a principle of birth, is one thing is the baby's head should always be flexed when it's coming out. So we want to do everything we can to have the chin tapped this way. The other thing that's really important is when the shoulders are like straight like this, there's a wider circumference. But when the shoulders are concave like this, so instead of like this, they're like this. Whenever the shoulders are like this, it's easier for the baby to get out. So whenever we can encourage the shoulders, then that's kind of what we're doing, is we're pushing this chest together like that. Okay. Now you guys are going to go ahead and do a scenario with wrapped cord and a shoulder dystocia. Is there anything else that we want to say about the shoulder dystocia? Where were we on here? Running start. Okay, we're going to go through these things. We're going to go through these things because I think it'll be easier for you to remember if you're actually watching. Okay, perfect. Okay. Do you want to have her be the mom this time? Switch?
Sure.
Yeah. Yeah. Faline has had a lot of experience, not only at her own births, but a lot of other people's births too.
Okay. So what position should I be in?
We're going to start you out in a position that babies are more likely to get stuck in. How about you lay down?
Yeah.
It could be that's the only position you've ever known, and that's the one you are used to, right?
Okay.
It's coming out. I'm not actually going with her.
Okay.
But I see that there's some turtling now because as she pushes, the baby's head comes out, but then it kind of sucks back in just a little bit, and she's pushing, but nothing's happening. And so, come on, Nikki, I'm gonna help you up. I want you to squat here in front of me, okay? Dad, can you help her?
Okay.
Put your arms around my neck. Here
we go. Okay.
Dad's helping.
Okay.
And push. Okay, and come on, stand up. And since it's out first, that's not a good thing. Okay, okay. Push. Oh, okay, now I want you to lunge. Can you put this leg forward like this? Okay. Okay, good. Okay, just try hands and knees. Okay, hands and knees. Dad, can you come up here? Thank you. When you're ready, push.
It's not coming.
Okay, let's try the McRoberts.
The suprapubic pressure.
Okay, we can
So
do
lay
the
down,
McRoberts
and I
first.
want you up
Or-
like this. Okay. Oh, cords around the neck. I'm not saying that to mom, but I'm somersaulting baby out. And baby is a little bit purple, but body looks okay. I'm passing baby. Here's your baby. Oh, checking for bleeding. Bleeding is more likely when they've been traumatized. Baby's just a little bruised, so the baby's doing great. Pinkening up very nicely. Oh, you're doing great. I noticed there's a gush of blood. I'm not going to worry about the bleeding, but do you feel like pushing? Yes. And I'm not really pulling on the cord. Okay. We got that. It's in a bowl. Setting it to the side.
Okay, so we're
Looking back
at
again
Mom.
here. I'm gently feeling her tummy. I'm just going to feel your tummy, okay? Everything feels good and tight. Baby's looking good. Touching baby.
We're gonna put the mummy straight
Mhm.
up and down on her skin to skin with a blanket on top.
Mhm. And we've got the blankets here.
And we're gonna check her bleeding. There's no bleeding. She's
Bleeding's
already
good.
checked her fundus, so
Yeah.
great job.
Okay. Do you need a drink?
I'm very thirsty.
You might even be
Yes.
hungry too.
Thank you.
Oh, you did amazing.
I have a question.
Okay.
Does the uterus really clamp down and go hard that fast?
Yep.
Okay.
Can?
Except with some moms who've either had a lot of babies, like some moms who've had many babies, it can get tired. Yes,
Okay.
you?
It can
Yeah.
also be stressed.
And also it can be stressed, or if she's had a induction of any kind,
Okay.
can be hard on the uterus, even if it was just castor oil, that can be hard.
So if it was boggy, then I would
This goes
explain
through.
what I'm doing, but I would just massage it until it hardened up. And if it didn't harden up, then
Can we go into a scenario
yeah,
with bleeding?
okay. So
I'm just gonna let's grab a pad for her, because we're definitely gonna need a pad.
So at this point, instead of bleeding's good, bleeding's not good. Here we go.
So maybe describe what good bleeding is. Like,
So are we doing placenta in or placenta out?
Placenta's out.
Placenta is out.
It's easier. Placenta's out, so you don't want to get, right now there shouldn't be any gushing, and the placenta should be hard and at the
the
area of the umbilical.
Uterus.
Yeah, the uterus
So
rather.
I'm noticing that the uterus is a bit soft, so I'm gently massaging. I'm not being rough, and I'm not coming down on it hard. I'm not pushing down a lot. If I do feel that I need to push down, I'm going to support her uterus with my other hand and kind of push it to my hand. I don't want to create more issues.
So she's cupping it.
Yeah, so I would cup it and kind of massage it. And I should notice that it does get hard and bleeding does slow down. If it does not, I continue that rubbing. And if I need to, I will hold it. I will hold it firmly in my hands.
Just like a tourniquet or a
Mhm.
tourniquet.
I will hold it down
Mhm.
in my hands. Now, some of the other things that I'm going to be doing while I'm doing that is I'm going to be telling mom how wonderful she is, how beautiful her baby is. I'm going to be encouraging the attempts at nursing. If I need to, I will take a pinch of the placenta, even just a small amount, and I will maybe put some honey on it and I will stick it in her cheek. And I can see here, just
Full
hold
of
that.
oxytocin.
Hold that in your cheek. I can also tell her to stop bleeding. We're done. You're safe. It's okay. We're going to stop bleeding now. So those are all steps that I could take in a low resource setting where I just have what I've got right here.
Mhm. And sometimes you might start massaging in there, and it might feel like there's actually something else still in there. And so sometimes clots can build up in there, and it's okay. You just keep massaging. It's kind of like they'll pop out like little jelly belly, like little jelly bellies. I mean, yeah, poop, 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 and it's like, it's good, because if they pop out, don't get freaked out.
So one of the big ones that I forgot to mention is if her bladder's full. A lot of times the uterus can't clamp down if she has a full bladder. When was the last time she peed. Normally in labor, you want to be encouraging mom to pee a lot.
At least
go
every 2
tinkle,
hours
tinkle.
or more.
And so that would be another thing that I'm going to want to do right now. With
And
the
a
bleeding.
full bladder can absolutely cause a hemorrhage. Think about it. You've got a balloon full of water in there pushing against this uterus that is trying to clamp down. You absolutely want to keep the bladder empty.
Yeah.
And she can pee on a pad, you know, right on the bed.
She can pee right there if she can't get up, because it could be very awkward to try to get a mother who's hemorrhaging to the bathroom. So if you have a pan or a bowl or just the pad underneath her, encourage her to pee.
Okay.
Could you explain to me a little bit more about what it means to have a uterus clamp down? Like, I don't really understand that.
Sure. Okay, so, well, your uterus is like an inverted pear. So think of a big giant pear. And as it's pushing the baby down, the muscles are just getting bigger and bigger and bigger on the top of the pear. Really what's happening is the pear is contracting together, and the top muscle is getting thicker and thicker, and it's pushing the baby down literally that way. The mother pushes, but honestly, the body pushes the baby out. It really does. I mean, the mother sometimes has to help with that. The reality is that you can't stop a baby from coming out when the hormones are working properly. And that's what we really want. We don't want mothers straining and bursting eyeball vessels and all that stuff. That's not healthy for the baby. That's blocking the oxygen supply off from the baby. So yes, we want to encourage the mother to do open glottis pushing, which means where you're pushing, and you really are pushing in your lower body, but you're keeping your throat open, and you're keeping your vagina and your vulva open, because they're both connected. The throat and the vulva are connected. If you can get her to relax her throat, her vulva will relax.
So what does a uterus feel like when it's clamped down in there? What are you going to feel, Charlene?
Oh, sorry. Thanks for getting me back on track. Okay. Could be a long answer to that question. Okay. So a uterus, if you're going in, so what was the point of all that discussion that I said?
What is this going to feel like? So what is it going to feel like when it's clamping
What it's
down?
going to feel like when it's clamping down is literally a hard grapefruit. And the mother can even massage it herself. Like, honestly, it's good to teach the mother, because you might not be there every single second. She shouldn't be alone at all for the first 24 hours. She could faint. She shouldn't be standing up and going to the bathroom by herself for the first 24 hours. And she should be, you should be able to, if you go in there and it just feels, either you can't feel anything, it just feels like a bunch of jelly, like bread dough kind of, that's a problem. You keep looking and looking and looking and looking and looking, and you keep massaging and massaging and massaging until you find that hard grapefruit, and it will eventually respond to your touch. And then when you leave it, like you'll have it holding it, you're holding it's hard, then you're slowly going to leave it, and you're just going to wait just a couple of minutes, and you're going to go down, maybe even only a minute, go down, see, is it still hard? Yep. Great. Okay, we're going to go back 2 minutes later. Is it hard? Yep. Great. 5 minutes. Is it hard? Yep. Great. And there's no bleeding. You keep in that, you're on that uterus, man. If you've had that happen, you're on it. Now, what you're going to do is you're going to, when you don't have that, okay? So say you go back and you just, it was hard like a few minutes ago. And then now you're going back and you're starting to see more trickling coming out. This can happen, right? And you're also seeing, oh my gosh, I can't feel it anymore. It feels like really, we call it boggy, kind of like bread dough, right? So we're going to massage. We're going to do whatever we can to make that happen. Prayer, intention, having the mother engage her, because like Nikki said, highly suggestible. Her body is so suggestible. Literally, you tell her to stop, she'll stop. I really know I've seen it happen multiple times. I've used it. So
But in most cases, you're not going to be massaging the uterus. You're
No.
just going to feel, oh
Mm-mm.
yes, it's firm, we're good. And then as long as you're not seeing any bleeding or anything, every now and then you might just touch to see
just
that
to
it's
check
firm, but
every
it's not,
10 or 15
a
minutes.
massage is not something you're going to just routinely do.
No, and you know, you'll see that in the hospital where they're in there like just wanking it, you know, even if somebody doesn't have any bleeding, it's like, no, under 2 cups of blood is considered a normal birth. Anything over 2 cups of blood. And now the way you can tell is you can put red food coloring in water and put a little thickener like cornstarch in there, and you can practice, you know, and you can practice throwing it onto pads and seeing what it is. And then like maybe getting someone else to put it on there for you, and then going in and seeing which pad has the half a cup, 1 cup, 1.5 cups, 2 cups, and 3 cups of blood. If it's a half a cup of blood, that's a placenta gush. Anything from 1/4 to a half a cup of blood, and you just see this red gush. Don't get alarmed at that. That's natural. That's a good sign. That means the placenta, which has been attached to the inside of the uterus, has detached. And that's a critical time for you to help the mother to get in a position where gravity is going to support her, and where she's tuning into her contractions and really focusing on her baby so that her contractions will stay, like I said, cocktails stay high.
May I ask
Any
a
other
question?
questions?
I have a
Sure.
question. So you had said earlier that you should stay with the mom for at least
I
24
can't
hours.
see your face, Becky.
Oh, where am I? I don't know.
I can see your beautiful breasts, so they're gorgeous.
Well, they're lovely. I grew them myself.
They
Thank
really
you.
are. Just want to
And
like
all the help from
put
my
my
babies.
head on them, and you could hug me, and I'll pretend you're my mommy.
Okay. So you were saying earlier that if you can't get the uterus to clamp down and they're bleeding, they could use a piece of placenta in their mouth.
Yes.
And you were saying that we should stay with the person for up to 24 hours to make sure they're not going to fat faint. How long in that period could you use that trick with the placenta? If she started bleeding again and things were boggy.
The whole time.
Okay.
Yeah.
Every time.
And you're not cutting the cord through all of this. You're leaving that intact for
Oh,
how long?
please, yes. Oh,
Yeah.
forever. Like really, it's better for the baby if there's no, it's an interruption. I would say a blanket interruption, any cord cutting. I don't think babies were meant to be detached from the placenta. It's a really high risk in a low resource setting. Risk of
Okay.
high risk of infection for a baby. It's not worth it, honestly, because you could cut the cord even with a sterile piece of scissors, but then that's an opening right there. That's an opening. So then you're going to have, what if that cord gets dropped into some poo-poo somewhere? I was going to say the S word, but I thought maybe. But do you know what I'm saying? Like, especially if she's in a like a camp or
If
a.
you're in low resource, don't cut it. If you'd like, you can look up lotus birth.
Yes, I
And-
know about lotus birthing, but
Yeah,
how
that'll
long
give
is it okay
another
to
idea.
leave that attached? Weeks?
Oh no, it'll fall right off within
Yeah,
3 or
about
5
3
days.
days.
3 days, you won't have it attached anymore. In
And
fact, the
what would
longer
you-
the cord, the quicker it falls off.
And what would you keep it in so that it's not making a mess or getting
Right. We
dirty?
just have Ziploc bags. We have 4 quart size Ziploc bags in our kits, and then
Perfect.
we wrap it in a blanket, right?
Yeah, you could even wrap it in a diaper.
And you can put herbs in there. You can rub the whole placenta front with like rosemary, lavender, pine, all kinds of different herbs. You just pack them on there, pack the herbs right on. They'll absorb the blood, and your placenta will just dry up and it won't stink.
Just
And you
herbs,
don't-
not essential oils, right?
Essential oils would be fine.
You could use either one.
You don't have to stay with the mom for 24 hours. Someone needs to stay with her.
Okay.
So it could be her mom,
Or her
it could be her husband,
Mhm.
another adult.
Okay.
Did you say quart or gallon?
Gallon size.
Gallon size, not quart.
Yeah, gallon size bags. Okay, let's move on. I would like to go through a couple other scenarios of the baby not breathing, and what else is something that we might. I would like to demonstrate rebozo.
Okay.
Okay, I don't know if have any of you ever heard of a rebozo or seen a rebozo? Okay, you have
Yeah, doulas
Pascaline,
usually
because
have.
you're a doula. So yes, a rebozo is from the Guatemala area, Guatemalan midwives have used it for centuries, probably millennia. And it helps to adjust the position of the baby to a really good vertical and aligned position with the spine. It helps the spine to realign as well as the baby to navigate the birth canal with the head basically adjusting to that position. So it could even help a shoulder dystocia. One of the main things that it really helps, I think, is either a posterior birth where the baby's back is to the mother's back, which can be very painful and difficult. It can still happen fine though. You can
Commonly called sunny side up.
I've delivered babies that way, and it may be more back pain, but it's possible, especially in a knee chest position is the best position for posterior that I've found. But what am I saying about that? My train of thought. See, she just put her hand on my arm. She just put her hand on my back, and now she's breathing. She's pacing me because I'm getting anxious, tiny bit anxious, because I have a slight brain trauma and I can't remember what I'm saying. That's the honest truth. My brain just went blank. But now my solar plexus is starting to calm down. You know, that's what calm is about. It's about like you're creating it right now. She's creating an energy right now and it's going into me and I'm going, oh, I just feel great. I don't know what I was talking about, but it's okay. So anyway, Pamela. Can't hear you, honey.
You were talking about the rebozo.
Oh, rebozo. Bueno. Okay, let's talk about the rebozo. Okay, you guys hold this. I'll go grab the rebozo. And then we're just going to have it there. And then at the end of the scenario, you're going to, or during the scenario, you're going to work it in. But we're going to have the baby have some issues as well. Okay, so this is going to be posterior.
We're also going to do a review cord wrapped babies.
Yes, thank you for the reminder, beloved one.
Okay.
Very, very, very best friend of my whole life who's on this call, Pamela Bigler. We've known each other for over 40 years. That girl is amazing to me. Okay, here we are.
So when we delivered the baby, you may not have noticed, but we somersaulted baby out.
Yes, she actually did demo that. It was kind of cool. It just kind of happened, right? But okay, this baby's got its cord attached in an unusual way, but it's good anyway. I just made these. Nikki helped me and they're awesome. I'm so happy. Okay, so we've got, doesn't really matter how many times, don't be afraid of a wrapped cord. Literally 25% to 40% of babies have a wrapped cord. So it's kind of not something to worry about. They do fine. Don't freak out. When you see the baby come out, you'll sort of see this around the neck, okay? You get a bit of a warning. It's good to be like Faye said, observe. That's your biggest tool is observation. And you observe, you don't absorb. You observe, you stay detached from outcomes and you stay detached from fear. If fear comes up, you alchemize fear. How do you alchemize fear? Well, your number one thing is your breath. The instant you start breathing, tapping into your breath, and then grounding your feet down into Mother Earth. So your tools are, you're a tree. Your roots go down into the earth, your branches go up to the heavens, and you grasp onto your deity, your God, whoever that is. For me, Mother, Father, and God. Mother, Father, God. And then you're grounded. So anything that happens, you're going to be strong. You just imagine the cord to heaven, the cord to Mother Earth. You're not alone. You got angels surrounding you in a circle. And you pace yourself. You bring your center back to your heart space. You get out of your head chakra, get down into your heart chakra, where you can stay in your body and not be out in your head and out of your body. So you want to be in your body. Here's what you do now. The baby is coming out. And you are going to keep the head close to the mother's body, as close to the mother's body as you can, while the baby's body is doing a somersault. It's called the somersault maneuver. Now here we are. Now easily from this position, we're able to unwind. And your instincts will kick in. I promise you that your instincts will kick in on this one, and you'll be able to know which direction to unwind. We're going to do a demo now for you, okay? And it's going to have the wrapped cord, and we're going to start out with a posterior baby that needs a bit of rebozo support.
Okay.
Okay, and Nikki's, you're going to have the baby in you, I think.
Okay.
Is that okay?
Yeah.
Sid?
Okay, so what position do you want me in?
Okay, so we've got a posterior baby, a sunny side up. We want that baby to turn. A lot of times the babies aren't going to come out until they turn.
The other way.
Other way, sorry.
Yes.
Yeah, so it's that way. Yeah. Oops.
Okay.
Okay.
So
So you're going to be having pain. Okay. And it's back pain, I think, actually.
now one of the things that I can do, I'm gonna put the rebozo on you.
Okay.
And this one we're gonna do candy wrapper. And I'm just gonna kind of shake it a bit, okay?
Okay. Oh. Oh. Breathe. You're doing great, Nikki.
Now labor takes a long time. So some of the other things that we might try, is there another one you want me to demonstrate?
Well, I was thinking that maybe you could do under her belly.
Oh, okay, like this.
Oh dear, sorry.
Mom, pendulous belly needs to come up. So I'm just gonna kind of support belly.
When the baby's not straight and it's pushing forward at the top, it can really have a hard time descending. So getting the baby aligned with the spine can really help. You can do this in a standing position too, and the mom can push the baby up if the baby's flipping forward, like with a pendulous abdomen.
And mom can do it herself by having it like this.
Yes.
And mom pulling herself.
Yeah, she can actually do it herself. She can walk around and pull it, and a lot of moms really like it.
And you could even put a ball in the back.
Inside like a tennis ball, and that can be
and
really
then they're
nice.
putting the pressure on themselves. But you can also do this for them, or dad can do it.
And that's the running start position. That's another position that's really, really great. And it also can help to put the foot up. Can you put the foot up on that? It can also help to elevate one foot while you're going back and forth in a seesaw motion.
Yeah.
That can really help with positional issues. Any positional issues really can help with this seesawing of the running start, especially if the elevated foot, and you can alternate feet. I want to do one other rebozo thing. Would you hold this? I'll do it, or do you want to finish something?
Shall we do the
Scenario first, and then I'll yeah.
Yeah.
Let's do the.
Okay. When baby moves into the correct position for birth, mom will usually, things will start moving along. You'll tell there's a difference, and then the pushing phase will start, which can take a while too. So what position do you want to be in, Mom? What feels best to you?
Hands and knees.
Okay. Checking in with babies, everything good?
Yeah, I think I felt them shift.
Was that a push, Mommy?
Yeah, I feel like I need to push.
You're doing great. Remember to breathe. Oh, that was a good push. I can feel the baby moving down. Okay.
Oh,
There's baby.
oh.
Baby out.
Okay, so skin to skin.
You wanna lay down?
I feel like I need to sit here until the placenta comes out. Is that correct?
How's baby doing?
Whatever you feel is best.
How's
Everything's
baby?
going real well.
Oh, okay. Yeah.
Let's see. Oh, come on. I'm just gonna take the baby for a second. Okay. I think we just need to give the baby some stimulation.
Okay. Oh.
Okay. Yeah, I think we still need some help for the baby. I'm gonna ask my helper, Shar, to help out with the baby.
Okay. All right. So first thing I'm going to do actually is get a towel.
Mhm.
And okay. Baby up.
Towel's a little bit wet.
That's okay.
So we're
This is a nice
stimulating
dry
baby.
Yeah. Good.
Oh,
Good. Hello, sweetheart. You can talk to your baby.
Oh.
Hi, honey. You know, I'm just going to give baby a breath. Okay. I'll give baby 5 rescue breaths.
little.
They're just what's in my cheek. The lungs are this big. So I'm just blowing in 5 rescue breaths.
Do all 5.
All 5, no matter what. So it's like 1 and 2 and breathe. Very slow. It's like blowing into a balloon. You want to blow soft at the beginning. You know, when you blow into a balloon, if you blow too hard, it's not gonna work. So you're gonna just blow real soft. And you want to watch the lungs that they're rising. You want to watch the chest, and the chest will rise if you're getting good breaths. Now, if you're not, we could have some mucus in there. Maybe the baby is a little bit mucusy right now, okay? But we don't use the bulb syringes anymore. They cause a vagal response in the baby's throat. We use postural drainage. And postural drainage is the most effective way. So mama, I'm just gonna take your baby for a minute, okay? And I'm gonna turn the baby over like this to help the baby's lungs clear, okay? I'll do it as close to the mom as I can, always making sure I ask permission and let the mother know what I'm doing so she feels safe and I don't take the baby away from her. If the baby still isn't breathing or having some hard time breathing, I could do some massaging from the base of the spine to the neck, 3 or 4 of those from the base of the spine to the neck. And that can really help not only release the fluid in that position, but also stimulate the baby and stimulate the breaths and the respiratory efforts of the baby. Most likely this baby's going to be breathing. Almost 100% of babies, probably 99% of babies after those 5 rescue breaths will be fine. And only maybe, 10% will ever need any help. So you've got, most babies, 90% of them are going to come out okay in most situations. Okay.
How much pressure do you use when you're massaging the back? Like how much would you say?
I would say you can be fairly firm with it. I would say you can be fairly firm because, like, for example, when you're doing chest compressions with the baby, which are rare. So just an example of to understand babies more than you understand people. If you've taken CPR, forget what you've learned about babies, okay? Because babies, with people, it's the heart that gets the breaths going and the heart rate is really critical. Well, the heart rate's critical, but what's more important is the respiratory and the lung inhalation and the lung expansion. So the alveoli are filled with fluid and they have to have the air has to come in quite quick, quite intensely at the beginning to push the fluid out in the bottom lung fields. That's why you don't stop. If the baby starts kind of taking a few little efforts and stuff, do the full 5, because it could be that those lower lung fields are still having some fluid, and you want to push that fluid out, give the baby the best possible chance for a good, don't be afraid to do respirations. Don't be afraid to, and if the baby's not breathing within 1 minute, it needs respirations, as far as I'm concerned. And that's the number one thing that will help a baby is respirations. But if in the event, now you can feel the cord, like the cord's attached right here. You can put your hand down and just feel the cord right here, and it will be pulsing. You can tell the heartbeat for the first 20 minutes or so. You can feel it here. So you can tell if the baby's heartbeat is beating. But even if the heartbeat isn't beating, the breaths are what you need. And you do a full round of at least a minute of breaths before you even would start chest compressions on a baby. You wouldn't start chest compressions. And if you had to do them, this is what you would do. You would go down right under the nipple, in between the 2 nipples, and you go down 1/3. So I mean, that's how deep you go, 1/3. So 1 and 2 and 3 and breathe. 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 And what came out in the latest neonatal resuscitation literature is that with babies, it builds momentum as you're doing the chest compressions. So you can't stop until you're at 60 seconds to check the heart rate. It has to be a full, and when we went and did this recently, it actually takes a bit of energy to do a full minute of chest compressions on a baby. I think it's a good thing to practice, if you ever want to do that, practice a few times so you get used to that, set a timer and do it.
Sorry, again, how many finger breaths between the nipples?
Two finger, well, it's 1/3 and it's two fingers. 1, 2, and 3 and breathe. 1 and 2 and 3. You want to have a hard surface on the back. I think actually resuscitating the baby right on the mother's chest is ideal. Personally, you've got a heat. And remember with kangaroo care that it's scientific, and we want to have a blanket on the outside. So we want to make sure baby's dry. Whoopsie. Baby's dry. Sorry. Can you tip it down? Mm-hmm. Baby's dry, mommy's dry, and we've got a blanket on top. So there's no way that baby's going to get cold. We've got the drafts, the doors, everything is shut. We're not letting any heat get out of this baby. We're making sure the head's dry. We're not putting a hat on the baby unless we're outside in a winter storm. Because there's hormones that are coming off this baby's head. Can you tip just down a bit? Oh, sorry, you want to see me, don't you? Okay, sorry. So, you want to let those hormones go to mommy, because mommy is that's part of that hormonal cocktail. All that smell from that baby is really, really going to get her doing everything she needs. It's imprinting, it's bonding, it's connecting. You don't want to block anything. And then, so you've got the mother skin to skin with the baby. The baby's going to be doing all this stuff. And then what else was I going to talk about? I think I was going to explain something else.
Well, I do want to say that when you have a mom who's in tune, when you have a mom that's really in tune with her baby and with her labor, a lot of times if the baby does need any help, the mom will do it themselves. And they won't do 5 and they won't do this and they won't do that. They will just do what moms do. She might just take that spit, have baby there, maybe give the baby some breaths. Moms instinctually can and will do what needs to be done, but sometimes they're so detached from their natural selves that they don't.
They're used to being told what to do. So anything that we can do to create sovereign sort of self-actualization for that woman, where she's making decisions on her own, and you can help her to learn how to do that at the beginning, where you're trusting her and you're listening to her and you're letting her guide you and you're listening to the things that she's saying, so that she starts to feel like she has a say, and that the things that she feels and believes matter in that birth. And so she starts to learn to trust her body to recenter if she gets off. Like, it's okay to have a moment. I mean, it's okay to have a moment or a couple moments where you're getting a little bit upset, or she is, or anything. And it's just about learning how to bring that energy back down, learning how to bring it back down to your heart space, and then help her center back down. Okay, so what other complications do we want to do? I felt like maybe, does anyone have any questions before we move on? No? Okay.
Well, we were going to demonstrate some more of the rebozo.
I just want to show one thing. Can you?
Yeah.
Can you? Okay. Well, one of the big things that happens, okay, I don't know why, it just does. I think it happens because of our society. We don't, you know, I think if you're walking, you're not sitting in reclining positions, you're not driving a lot, and you're not sitting on the couch, you're squatting, you're forward leaning positions and stuff, then you're going to have less malpositioning, which malpositioning is probably the number one thing that inhibits birth and labor from going normally, right? Mm-hmm. Other than you know, the environment, which we've discussed a lot today. But so what you want to do is you want to, if she has well, you want to encourage people during labor, if you have any influence over them, to not do those laying back positions, because they cause asynclitism, which I'm going to explain. And they also cause posterior positioning, okay? You want to have, also, you want to have good muscle tone down there. So I think a 30-minute walk every day is really healthy for pregnant moms. So, but what am I showing here? Can't remember.
Some posterior.
Yes,
maybe?
asynclitic. Okay, I'll get this. So your asynclitic is the baby's head is like, you know, well flexed, but what happens is it can go from either that side or that side. That's a really typical thing. It's called asyncliticism. And okay, a really great way to get this out with the rebozo, I'm going to show you right now. Okay, you determine, if you can, which way the baby's tipped with its head, and you can also determine which position the baby's in. Let's start with posterior. So let's say the baby is a little bit tipped with the head, plus the baby's turned around the wrong way. So what are we going to do? You're going to get on your hands and knees. Do you mind getting up on your hands and knees, honey? I'll help you. Okay. We'll get you over here. How's that on your knees? Do you need anything else under your knees? Making sure the mom has stuff under her knees, and make sure you have stuff. Like, take care of yourself. Self-care is really important for staying calm. Having your needs met. So that means making sure you eat, you drink, you know, rest when you can. If she's resting, rest. Take care of yourself if you're at a birth. It can be very long and grueling, and it can be exhausting. Don't get too excited at the beginning. You know, pace yourself. So say, for example, I know this baby, her back is right here. This baby's back's right here, okay, on this left side. This is the shortest distance to the front. If the baby was on the right side, this would be the shortest distance to the front. But in this case, it's on the left. So the left side's the shortest distance to the front. So what I'm going to do is I'm going to do the same idea with the candy wrapper. Okay. But now I'm going to jerk it to that side every so often. Jiggle, jiggle, jerk. Jiggle, 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 jerk. Jiggle, 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 jerk. You can get the dad to do this, or a friend or a doula. And I have seen babies turn within about half an hour of this, after hours of not turning. So yeah, it works. That's one thing I wanted to show. How are we doing now? We've got any more questions, or should we just move on? I thought we'd do a breach.
Breach is always fun.
Yeah, let's do that just for fun.
Okay.
Maybe we'll have Nikki read it.
Okay. All right, hands off, stay calm. Mother in upright position, leaning forward like on hands and knees. Allow the body of the baby to hang and deliver. Baby's back must be towards mother's belly. If not, the legs are out. Hold baby by hip bones. Gently lift upward, then rotate. Have mother avoid actively pushing until baby is fully born to the umbilicus. Encourage focused breathing. Keep room warm. Prepare dry towels to greet the baby. Be sure to allow time for head to flex as body hangs and helps with this process.
We're going to demonstrate.
Be ready to give inflation breaths.
And those are the 5 inflation breaths that I mentioned. Now, with the breech birth, there's been a 40-year breech study. We've been told that breech was a high-risk birth and that, you know, everybody has to have cesarean. What happened was the obstetricians that knew how to do the births stopped doing them, so they lost the skill in our country. And then in France and other countries, they have retained that skill and started publishing their findings, and also did a full-on study, which found there was no difference in the outcomes in any breech deliveries, like compared to regular deliveries. It's a myth. Babies it's just a variation of normal, just like the cord around the neck. So let go of all the fear around breech or cords. And the reality is that sometimes these babies aren't stimulated quite to the extent that the vertex or head first babies are. So just keep in mind that they might need a little more time. Give them a full minute to react. That cord blood is being pulsed into that baby. They're being oxygenated just like they were inside the uterus. The doctors in France say they do nothing for the first minute, even if the baby's just laying there. And they have exactly the same outcomes as if they intervened in that first minute. So you just have faith, but you might have to give that baby a little more stimulation, drying, and breaths, because it is less stimulating in the birth canal, which is what they need to get those lungs expanding, because the lungs have to be highly squeezed, and then when they come out, they expand. That's how it works. The squeeze is very important. Okay, I think we'll go through one. Would you like to be the mama in this one?
I'll be mama.
Okay.
You deliver.
Okay, and you're gonna hold the
Nikki,
film.
You're gonna film.
Thank you.
You're
I'm
gonna
gonna
record.
get a dry towel, actually. Let me get a dry towel. Always change it. Another one, and replace that towel because it's wet near the baby or the mother after the birth. Okay, so what are we doing? We're doing.
I'm actually gonna do hands and so I'm gonna be up here, and I'm gonna use my hands a lot to show baby coming out.
Okay. Okay.
Okay, so that you don't have to touch as much and you can more
Let's see.
accurately,
I'm going to be over.
show.
Sorry.
what's going on.
Gonna be.
Okay, so just to give you a sense of things for how this works, you really want to be able to have the mother in a position where the baby can hang. So if she can lean over something and we're gonna probably eventually, yeah, we're gonna need more, but to hang. And why do we want the baby to hang? Well, one of the reasons is when a baby hangs, we got another doll. Hang on, you keep that doll. I'm gonna get another doll.
So.
Okay, but just for example, 2 things. When the baby's coming out, the mother does not push at all. She just breathes and blows and doesn't push. That's one of the hallmark principles of delivering a breech safely, is that you let the baby just come out naturally until it gets to the umbilical cord. Once it gets to the cord and the cord's out, then she can push the baby out, and she should. And then with contractions, and then what happens is when the baby hangs, when the baby.
Here's baby's vocals out, and so here's baby, here's mom.
So here's baby. So what's happening is this head is going to be nicely tucked because the weight of the body is pulling the baby down, and this head is tucking. And when the head's tucking, the circumference of the head is going to be much lower than it would if it was straight up and down like this. So that's why the hanging is vital, and you don't want to disrupt that. You don't need to disrupt that. You can just let the mom have the baby hang. Keeping the room warm is important. Having a dry towel, which I just got.
Hopefully warmed in the dryer.
Yeah, a dry towel, and you're gonna dry that baby. You're not gonna dry the baby off. You're just gonna have that towel ready to catch the baby so that it's not all slippery when the baby comes out, okay? So, but let's go ahead and do a full demo now.
Surprise breach.
A surprise breach. So we don't expect this baby to be breached. She didn't know she was having a breach, and we're just here helping her in an unexpected circumstance. One thing that we might see, just to give you a little heads up, if with a breach, to give you a warning, is you may see pure black meconium coming out of the introitus, out of the opening of the vagina, right before the delivery of the baby. And that can be an indication that the baby just pooped. Don't worry about it. With a breech baby, they almost all poop. It's not a big deal. Okay, so let's go ahead and okay, Mom, how you doing?
Oh, there's a lot of pressure down
A
there.
lot of pressure. That's okay. You just lean and just relax. You're doing great. Faye, you're doing really good. Baby's right there. I can see baby's legs or baby's bum.
What?
I can see baby's bum. I think you got a big little bump there. That's okay. You know what? You just breathe. You just, yes, it's going to be perfectly fine. This is just perfectly fine. It's coming out just nicely. Just take your time. You just let your body do it, okay? Whew. That's right. That's right, Faye. You got this. Okay. I can see the baby's umbilical cord there, so you can actually push now. Oh, yeah. Oh, doing great. Oh, yes, excellent. You see the baby's arms. So now we're going to wait for the next contraction. We're not going to try to rush this, even though the head's inside. Just letting the baby hang there. And Mama's nice and tall. She's putting one leg up. Yeah, there we go. And there you go. Oh, that's great. There's your baby. We're always going to put it between her legs because the cord's attached. Or if we have to do something right here, we'll do it. But the baby looks okay. We'll just pass the baby up to Mama and give Mama a chance to bond with her baby. She's just going right in there with her baby. You did it, babe. Excellent. And baby's doing great.
I have a question, Shar.
Okay.
What if one arm is up and one arm is down?
Yeah. Okay. So if you, what happens is sometimes you'll have where the body's coming out, right? And the legs are kind of just really, really tight. Usually if you leave them, they'll just come out on their own. But sometimes it'll get to the point where you just kind of bend the knee a little bit. You just flex that knee a little bit and you swipe it over and it just comes out. And then you bend this knee and you swipe it and it comes down. But usually you don't have to do that, okay? That's only if there's some reason it doesn't seem like they're gonna come. Now with the arms, that's why you don't wanna rush a breech birth because the baby's arms will usually be like this and that's ideal. If the baby's afraid, startled, rushed, or not getting enough oxygen, the hands can go up like that and that can be much harder because look at how wide that is. So yes, that's a great question. I think another reason why to not rush, to not stress the mother, to have her push consistently with contractions from the time the baby's born to the umbilicus though, because the baby needs to be born promptly. I'm just saying that you don't want to slow anything down at that point. You want to keep it going.
So let's say it's a breech. You've noticed the meconium. And the first thing you see is a foot. Don't freak out. A lot of times baby is like this with their knees up and their feet right down here. This is not a footling. A lot of people get confused. It just is, there's a foot coming out, but it's not a footling breech. That's a very different thing. But this is common for baby just to have little feet down there and a scrotum if it's a boy.
And just don't be surprised if you see a scrotum that looks as big as a head. and it's red, and that thing is just like you think something's wrong, but it's not. It'll go down. It's just inflamed from that. Whenever they come out this way and their scrotums are really pressured, they get really inflamed and edematous and red. It can be a little startling, actually, but don't worry. But the other thing I wanted to say is, if the hands are up, okay, and the baby's coming down, and you can see that they're up, and you kind of have a sense that they're not coming on their own. They're not here where they're supposed to be. Then I'm gonna have you hold it. So then you could go in. So then you could go in, and you're gonna go right up inside, and you're gonna gently flex the arm, sweep the arm over the front of the body and help that arm out. Go in on the other side, gently flex the arm, sweep the arm over the front of the body and let that arm out, and those will come down. Now there's one other maneuver I want to teach you that's kind of, you see, we don't really teach hands in the vagina. You got to wash your hands. You got to make sure if you have gloves to wear them, all that. So we don't usually teach that, but I like to teach that one maneuver to you. And the other one I want to teach you that's kind of a little bit advanced is if the baby shoulder dystocia, say you tried everything and you couldn't get the baby out. Say you tried all that stuff we shared with you. You've got a baby that's stuck here behind the pubic bone, right there, okay? Now, this back part over here, this back part, I'm just gonna take the baby out for a minute. This back part here where you see the base of the back of the spine, there's a lot more room up there in here than there is in the front. And if you can get that posterior shoulder out of there, you're going to have an anterior shoulder like that. So I'm just going to demonstrate that. We won't use that. Okay, and then, so what I'm going to do is I'm going to go in this way. I'm going to go in down. I'm going to flex that posterior arm up over the face. Bring that little hand out right there. I'm going to have a baby. We're going to have a baby, no problem. It works every time. Well, it doesn't work every time, but it works almost every time. If you, as a last resort, if you can't get the other.
As a last resort.
As a last resort.
Again from the top view.
Why don't we do a scenario, another scenario?
Okay.
How about you, the midwife? I'll hold this. And let's go through, and we're gonna do a cord around the neck, a sticky shoulder, and a hemorrhage. Okay. And the baby's not breathing. Okay, we're just gonna try to accommodate those. Let's face it, those are the most. Those are the most common. Really stressed. That's right. Okay, so we're combining these together here. And
okay. So I also want to point out with the cord, baby's shoulders do normally, and they go forward like that. And there is a space right there for the cord to come through. That's where cord is most likely resting every time. If you have the cord around the neck, you start messing with the cord, you will probably pull that out of its safe space right there. So just, that's one of the reasons we deliver with the cord, if at all possible.
Can I make one comment? Also, that to add on to that, when you're doing the delivery of the breech, once the baby comes out and you can see the cord, if it's slightly to the right or slightly to the left, and you can just gently tuck it over if it'll let you, to put it aligned in the middle, that'll give it the best chance of having the most perfusion and less pinching. Okay. During the second part of the pushing.
Okay.
Well, I'll remind you.
Yeah, you just holler out.
I will.
What's going
I'll
on.
remind you.
I don't know if I can do this.
You're doing it, she says. You've got this. You're doing it. Now, some women like that, and some women won't want that much closeness, but lots of times they do. at certain stages, like at the end.
Here's your water.
So she's giving her some water.
We're almost done. So strong. You need to go ahead.
Oh, yeah. Has the knees. Oh,
Back pressure. Does that feel good?
oh, yeah.
Okay. I can see the head. You're doing great. Breathe. Oh, I think we're gonna need to change position. Could you
Some turtling.
put a leg up? The one that feels the best. Just go ahead and put the one that feels the best up. Oh. Good. Good. Go ahead and push with your next contraction. Okay, I'm gonna want you to stand up. Okay, if you can.
It's good if you have two people, one on each side, and then you say 1, 2, 3 up if you have to do that.
Lean on me. With your next contraction, go ahead and push.
Oh, there's your baby here. I have you. Here we go. Oh, okay.
Baby's perfect.
Oh, oh.
Taking, feeling that the cord is pulsing. Not seeing any breaths yet. I'm not saying that to mom.
Susan Blue, is you okay?
Do you want to lay down now?
Yeah.
Here, let me get you a pillow.
Oh.
Just relax. You're amazing. I'm just gonna roll baby over.
Is he okay?
Yes, the cord is still pulsing. The baby is doing just fine. Okay. Just gonna give the baby some time, okay? Because the cord's still pulsing, I'm just going to try to let the fluid drain. Okay. I'm gonna give the baby some breaths, okay?
Is he okay?
Yes,
Nice and warm.
baby's
Melt your
fine.
skin. Baby's just fine.
Okay.
Baby just needs a little help.
Okay. Chest is rising. There we go.
Oh, baby's.
Mama. If you feel the need to push, go ahead and push a little, okay?
Yeah.
Let me see.
And it's just sitting in there, but it's not coming out. Don't really want to pull it. Could you just cough a little bit for me? Okay. There we go. There we go. And cover your eyes back up again. Oh, nice and warm. Okay, here's your water. Hopefully I've got an assistant or someone helping me.
I want to demonstrate one thing. Do you mind?
Yes, please.
Okay, so we are still going to have a hemorrhage, but I just want to say something about the placenta delivery. You have to really tip it. You have to like look at this one. You can see. Like this. Yeah.
Mm-hmm.
When it's coming out. Yeah, when it's coming out, sometimes there will be membranes. Like it's coming out, but you'll see like a membrane that's kind of going inside still. Maybe it hasn't come out. You don't want to pull on it because you don't want that to tear, right? So one of the ways that you can actually help that just to come out easy is you just take the placenta and you just kind of turn it gently like this. And the membrane will just form like a little round tube, and eventually it'll just slide right out of the vagina. I just wanted to mention that if you had a hard time with it coming out fully. But usually it'll come out one piece like that. Okay, now we're gonna just, oftentimes if there's a shoulder dystocia, and if there has been a difficult delivery, the baby could have more need for resuscitation, and there could be more need for, active management of postpartum hemorrhage because it has a higher risk with those kinds of complications in addition, just to FYI. Okay.
I have a question.
Okay.
You mentioned earlier if baby had mucus. So when baby has mucus, you just put him on his tummy, on your forearm, and then you massage his back. Is that what you did, or
That's
you
what we
didn't finish
teach.
your sentence about,
Well,
if
that's
baby
what we
has mucus?
teach. That's what we teach. Yes, that's what we teach in our classes. We're teaching low resource management, right? So, but what I recommend is if you can get a DELE, I mean, this is really the best. If you can't get the mucus out with the postural drainage, or, sometimes the mother or father will just put their mouth right over the baby's nose and mouth, suck and spit. That's another way if you don't have any tools. But this is a very simple little tool you can buy. It's called the DELE. This end goes in the midwife or the care provider or the responder. And then this one goes inside the baby's mouth and the two nares. The mouth first, then the two nares, and you're sucking. Okay, that's a DELE.
So how different is that from the pear suction thing?
Those little suction devices cause a vagal response in the baby, so it causes them to have respiratory distress. So we don't use them anymore. They're totally obsolete in all the practices that I know of anymore, except for maybe some archaic hospitals, because they've been proven to cause a vagal response and they're not as effective. So if you want to do suctioning, no point in causing a vagal response if you're not even going to use an effective tool. You need to use I use electric suction or a DELE. Those are the two things. Okay, I have an electric suction machine. It's very effective. It's loud. It can be a little bit loud, but I like it. But a DELE is effective too. I think a DELE is really simple and yeah.
Taking a little bit of gauze and just swiping the mouth is also something that you can do.
Yep. Because sometimes just that little, maybe just a little bit of mucus around the nose and the mouth that needs to be kind of removed. It's slippery. It can prevent a good latch too if it's too slippery.
And a lot of times babies will be working mucus out. Some babies have a lot of mucus to work out, some babies don't, but it's not a reason to freak out.
The number one thing that helps the babies to get the mucus worked out is the breastfeeding, the immediate golden 2 hours of breastfeeding. So the first 2 hours are golden. And of course, the first 24 hours are golden too. But those first 2 hours of bonding, imprinting, and breastfeeding is absolutely the most critical part of that entire process, as far as I'm concerned, for enriching the bond and enriching the imprinting on the baby and the mom. So should we go through the scenario then?
The hemorrhage.
Yeah.
So she's had a stressful delivery. Her baby's finally here. The baby was stuck. There was a lot of trauma going on. Placenta's out. She's continuing to bleed. I can feel that her uterus is soft. Maybe this is her 9th or 10th child. And so I'm feeling. And okay, I can feel it starting to harden up. I'm going to take both hands. I'm massaging that. Like I said before, I'm not going to push it down because I don't want to create a problem where we're getting a prolapse or something. So I'm supporting that massage. And if I really have to push down, I'm supporting it. And I'm finding that it's not firming up the way I'd like. And so I am going to hold it. And as I start to come off, it's not staying firm, so I'm going to keep holding it. And I will give it a few tries, like, oh, no, I'll keep holding it. And if I have to, I'll get someone to switch me out and I will just keep holding it.
Just like you would a bleeding wound or something, you know, I've held a uterus for 40 minutes. I was sore for 3 weeks after, but you know, if you have to, for some reason, to hold it, if there's nothing else going on, she's not bleeding and you're keeping it strong, sometimes it just needs a little help. And as long as when you take your hands away, there's no obvious bleeding and it stays firm, then you've done your job and you're okay. And then you just want to keep checking periodically. You could use
Are there any herbal remedies or herbal teas that can be given to the mother at that time to help with hemorrhaging?
Yes, you can definitely. If the placenta is still inside, you can use angelica root tincture. If the placenta is inside, excuse me, I need a drink. Celery. If she's already had the placenta, I recommend a combination tincture. Usually is really good. You can get fresh or make fresh shepherd's purse. We have shepherd's purse right here. You can make a fresh shepherd's purse tincture. You could give her cinnamon. You could give her like a nice combination of different black cohosh and blue cohosh that they put it all together for you. And you can just give her like maybe 2 or 3 full dropperfuls under the tongue or in a little cup of water that she sips, or not sips, but downs. And you give it to her every, like if you're using herbs, you give it to them every 5 to 10 minutes. You keep redosing it until it works. If, you know, that's what I usually do. You can use homeopathic remedies. You have to be pretty skilled to know. China's a really one that I've used. What you can do is you can, if you intuitively know, oh, this remedy is going to work. Like I feel really strongly this is buzzing my feet. So I know intuitively I'm getting a definite yes on this. But if you intuitively give her a remedy, like say it's China, that could just instantly fix the bleed. And then you don't have to do you don't have to worry about anything else. But that's after you've done the manual stuff and everything. I think the manual stuff is more important than, giving stuff by mouth. But then, yes. And then the other thing is afterwards, I think giving chlorophyll and Floridix formula, if she's had a bleed, you give her those things routinely every day, Floridix and chlorophyll to replace the blood. So, yeah, what time are we at? How are we doing for time?
I have no idea.
Does anybody know what time it is? We've had a few people leave, so I wonder if we're past our noon. Yes.
12:20.
Yeah, 12:20. So we went 20 minutes over. Okay. So I think we're going to probably close out. Does anybody have any questions before we do that?
I do have a question.
Okay.
I don't know what it was called, but it happened with one or two of my babies. And when I was in labor, it was almost like the baby was hitting the uterine wall. And I just remember her physically going in and holding it, which was very uncomfortable, but she did something and held. And it was only a few minutes, but then after that, it was fine. Do you know what I'm talking about?
So is she talking about a lip on the cervix?
Oh, maybe that's because
Yeah.
as I would push,
Basically,
it was like
hip.
nothing happened.
Right. You had a swollen cervical lip probably where you had been put. And so then I've done that many times.
Okay.
It's just so easy. Like,
okay.
I'm not saying you would do it if
No.
you didn't have any experience or
Yeah.
sanitation, but if you were really experienced, I'm just explaining what I've done it not too much, but yes, if you have to, especially with first time moms, sometimes with even really experienced moms, if that lip gets swollen and you just basically reach up and you massage the lip back during the contraction, and you just keep going back and you massage it back, and it hurts like crazy.
Yes, it does.
But it works if you need to get the baby out. It really does.
Okay. Is there, I have read that you can use lobelia to help with that. Is that yes or no?
The lobelia is sorry, go ahead.
For the cervical lip.
Yes, because it's a relaxer. So it's yes, the lobelia will soften and relax. You don't want to use too much lobelia if you don't have a problem, because you could cause the uterus to get too relaxed.
Right.
So, it's always with herbs, it's if they're indicated, they can be great.
Right.
But you don't want to go into using herbs or any interventions unless they're actually indicated.
Okay.
Because
Perfect.
they're powerful. Just Mother Earth gives us the herbs and we use them because she is there for us when we need her. But we don't need to use them if they're not indicated. Okay.
Okay. Perfect.
So we should have a closing little thing here. Let's do a closing thing. Is that thank you so much, everybody. This has been so enriching. I'm so happy. Erin and Anne and Amber and Pascaline and Deb, thanks for joining us and staying with us even past the 12 o'clock mark. We did get started a bit late, didn't we? And we'll probably do another one of these, maybe get into more details. But for now, let's just do a closing little ritual here. I'd like to do a women's song. What's the song what's that song that I used to do? In my book to do this song, so just a second here.
So, and I am not a trained birth worker for going in. So the things that I would do for a cervical lip or something like that, if I felt that that's what was going on, is I would have mom with her head inverted. So her head would be down and her hips would be up. Because I wouldn't be putting my hands inside the mom.
So like if she was on her knees, her head would be down and
Head
below
down
her
on a
hips?
pillow and
Okay.
to take the pressure off of that.
Okay.
Sorry, I thought I had it. Okay, I have to do something different, so I guess. I wanted to do one that one about women. I know it. ancient ones. The women and the wisdom. The women and the wisdom. We are sisters on a journey, shining in the sun, shining through the darkest night. The women and the wisdom. The women and the wisdom. We are sisters on a journey, healing now as one, remembering the ancient ones. The women and the wisdom. The women and the wisdom. Okay. Remembered a little of that. Amber, would you like to say our closing prayer in our circle?
Sure. Yeah.
Okay, we're going to hold hands and we're going to pretend we're holding hands with all of you too.
All right. Our dear Father, we pray unto thee and thank thee for this wonderful class that we've been able to attend with Charlene and others. We're grateful for the wisdom and information we've been able to learn and gather, and we ask thee that thou might bless us to always be able to retain that information, that it might dwell within us until it's time for us to use it, and that we might recall it easily. We pray that we might be guided by the angels in situations of birthing. Please guide us and bless those here that will be in situations regularly. We bless the mothers also that are all bringing children into this world. We ask for them to feel of thy love and that they might recognize their important role and great sacrifice to do so. We bless for these babies that they might come to strong bodies. And we thank thee for the love that's been here. And we pray in the name of Jesus Christ. Amen.
Amen. I feel fantastic. I'm so happy. Thank you so much for coming, and bless you all. Bless your day.
Thank you so much. Bye.
Thank you, you guys.
Bye.
Thank you. Thank you.
That was really nice, wasn't it?